I get asked 3 or 4 times a week at least, can CBD help me stop smoking or at least reduce my cravings for smoking? I'm Dr. Jim. My topic today is a really good one. If you are a smoker and you're trying to quit, if you know smokers and they're trying to quit, I have some interesting information for you, okay? My topic, can CBD help with nicotine addiction? Nicotine addiction, or what the latest version of the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, refers to as tobacco use disorder. So some people still say nicotine addiction. In psychiatric circles, medical circles, we refer to it as tobacco use disorder. What is it? It's a serious, life-threatening condition that affects millions and millions of Americans here in the U.S. and countless others around the world. According to the National Institute on Drug Abuse, among people in the United States 21 years of age and older, 22% or 61.6 million people use tobacco products or they vape nicotine. Okay. Although there are nicotine replacement medicines out there and treatments and other methods that are used to quit smoking, researchers are taking a very serious look into the impact of CBD and how it can either reduce or help people to completely stop using tobacco or nicotine. So, CBD and tobacco use disorder. Let's go into tobacco use disorder a little bit more because a lot of people just don't call it that. So the DSM defines tobacco use disorder as a pattern of tobacco use which is problematic and leads to significant clinical impairment or distress. It involves using larger amounts of nicotine over a long period of time, having a persistent desire and craving for it, and having no success at cutting down or quitting altogether. Use is continued despite any physical or psychological harm, and tolerance then is likely to develop. So, I know I should stop. I'm coughing. I'm out of breath. But I still can't stop. That would be tobacco use disorder. Serious medical conditions, though, like lung cancer and other types of cancers, cardiac and pulmonary diseases, chronic cough, shortness of breath, as well as accelerated aging of the skin, are all associated with tobacco and nicotine use. Okay? So what is nicotine? Nicotine is the major pharmacologically active substance in tobacco products and e-cigarettes and is responsible for dependency. Nicotine metabolizes. It metabolizes quickly, and smokers have to adjust their tobacco use to achieve brain nicotine concentrations that keep them satisfied. In other words, I need to smoke more to feel better in my brain. Nicotine is connecting with other nicotine receptors, and they're having a party in your brain. An important pathway. Now, I'm going to go into the weeds just for a second. Forgive me, but this is really fascinating, and it explains how CBD works for decreasing nicotine problems. An important pathway for nicotine is the oxidation of CYP2A6 to form the inactive metabolite cotinine. Okay, decreased levels of CYP2O6 are associated with less consumption of nicotine cotinine, which is an alkaloid found in tobacco and is the major metabolite of nicotine. Okay, so let's talk about methods and medications used to quit smoking, and then I'll go right into the CBD research findings. There are a number of quit smoking prescription medications. They're all over the place. Nicotine, they're called technically nicotine replacement medicines. Patches, gums, nasal sprays, lozenges, oral inhalants, medications like Chantix and Wellbutrin are all available. A lot of side effects potentially, though. Weight gain or weight loss. I know a lot of folks who say, if I stop smoking, I'm going to be eating more. Or if I go on a particular medication, I'm going to gain weight. And so they're choosing, one for the other. Other side effects: fatigue, nausea, constipation, headaches, strange dreams. That's something to Google. And changes in taste can occur. So, CBD and nicotine. Drum roll, please. A study was recently published. I read it from start to finish, every single word, highlighted it, dog-eared it, went back to it, cross-referenced it. A recent study was published by a group of researchers examining the impact of CBD and its active metabolite, 7-OH-CBD, on nicotine metabolism. CBD has a metabolite that works on the metabolism of nicotine, okay? Researchers discovered that CBD and 7-OH-CBD inhibited CYP2A6 mediated nicotine metabolism through a very complicated biochemical cascade. In essence, in plain English, CBD and 7-OH-CBD inhibit or reduce expression of CYP2A6, which oxidizes both nicotine and cotinine, leading to decreased dependence on tobacco and other products, or complete cessation, which means completely quitting smoking. So there you have it. A lot of Americans struggle to kick the habit. They try this and they try that. There are medications on the market. There are therapies that you could get involved in, so on and so forth. What certain researchers are telling us right now is that CBD can actually reduce nicotine dependence or help an individual to kick the habit completely. I'm Dr. Jim. Keep coming back for more information, and as always, I wish you the best in health, wellness, and happiness. Thank you for watching the video, and I'd like to show you my new book, Living Longer and Stronger with CBD. It took me about a year and a half to write as I scanned hundreds of articles in prestigious journals, peer-reviewed medical studies, examining the effects of CBD for various physical conditions, emotional and mental issues, and neurodegenerative conditions. And I condensed all of those findings into one book. I believe that there's something in here for everyone. So if you're interested, follow the link to the book on Amazon. Thank you so much.